Hello, I'm Alice Fornari. I'm the program director for the Masters of Science in Health Professions, Pedagogy, and Leadership. We welcome you to a webinar to hear about this program, but most important, we'd like to hear your questions so I'm able to answer them as the program director of this program. You can type a message or a question in the bottom left. There's a chat box, or we'll open up the mic for questions live at the end of the brief presentation that we have about the program. I also have some additional literature that I could send to individuals if they're interested after hearing this about why a master's in health professions, pedagogy, and leadership is valuable to a career that you're pursuing. So who should apply to this type of degree? So that you have to be a health professional or a health professional administrator to get into this program. So you have to be teaching in clinical fields, overseeing an educational program, a health professions educational program, I should say, leadership roles in healthcare education settings, and thinking of a career track as an educator scholar, because there is a piece of the program that relates to doing health professions research and scholarship during a capstone course that is part of the program and required. More details to follow. The goals of the degree are really to introduce to the learners who attend this session innovative evidence-based educational programs, how to plan and implement them. So many health professionals are involved in designing and implementing or evaluating new programs, and this will give you a core background, very strong in innovative evidence-based educational program design, implementation, and evaluation. It will also help you to learn how to do continuous quality improvement, but with education strategies. So I know many health professionals are involved in quality improvement work from the clinical lens, but this is quality improvement work from the educational lens. Another goal of the program is to develop effective teaching skills in a multitude of settings wherever practice occurs and with diverse adult learners. So obviously the health professionals in this program are in different settings. Some are classroom-based, some are clinical-based, some are community-based. The people they're interacting with are adults. This has nothing to do with K through 12 education. It's really working with adults who are pursuing education in the health professions in any of the settings I mentioned, community, clinical, or classroom. So there is a strong focus on improving your teaching skills, but most important, that your learners will be able to learn better and enjoy learning. Assessment and program evaluation I mentioned. And the second piece of this program is leadership. So being able to lead education initiatives and programs with new energy, knowledge, and skills. And the last piece through the capstone project that's required is conduct and disseminate scholarship related to educational research and clinical learning environments. I just want to say that the program really has two forks to it. It has a leadership fork and a teaching and learning fork. They all merge together in a professional career, but the way the education goes, there's really a dual focus here. In addition, the capstone project will either focus on leadership or teaching and learning, most likely, and bring everything together from each of those forks in the road. I just want to say that the core assignments and projects are really very, very practical. The courses offer practical assignments that relate to your daily work. So you would be learning things that you could do a project on in the class that would give you credit for the class, but hopefully would also apply to your clinical environment where you work, or your community environment, or your academic environment. So you're really double dipping, where you're doing something good for work and you're doing something for the classroom. And it's very important to me that everything you do in this program has a practical lens and applicable to your work and education environments. There are 5 content areas for these programs. I just would like to mention that there are over 100 of these programs internationally. I have a handout that describes this, that if anybody's interested, I could send, but there's over 100 of these programs internationally, probably closer to about 130 now. All of them cover the same areas of core content: teaching and learning, curriculum development, evaluation and assessment of programs, research methods, and leadership and management related to education. So I am not making up what the core content is. This is a known fact among these programs internationally. The program has 30 semester hours required. In order to get a master's in New York State, the minimum number of credits is 30. So I've chosen the 30 not to be a minimalistic, but to assure that people who are coming here all have done education prior. So I didn't want to burden them with extra coursework beyond the minimum. I feel in this 30 semester hours, I can meet the quality of education to give them new knowledge and skills to take back with them to their work environment. This is especially true when you finish the capstone project, which will hopefully be a project that will be very applicable to the work environment and be considered scholarship and publishable. My goal is to do cohort education with peer support and learning. So I have my first cohort now. It's 13 doctors and 2 nurses and a medical technologist. They're a cohort from cohort 1. I'm recruiting for cohort 2 for September. And in the cohort model is you provide support to each other, you do peer learning, and you do peer support. And I have to say, in my current cohort, this has been achieved to the fullest extent I can imagine. And the result of that is because the learning environments support this. And I think it's an added benefit to being in a cohort program to learn this way, especially for adult learners. It's a hybrid course delivery. What do I mean by that? And if you've been out of education a while, you probably are very familiar with face-to-face classroom teaching, which is the way I went to school, both my bachelor's, master's, and doctorate. But today, with the ability to do online learning, as an educator planning curriculum, like all of you will be trained to plan curriculum as part of this program, you have to think about online learning. So I offer 2 courses every semester. One is online and one is face-to-face, but delivered in an executive model. So what do I mean by an executive model? I don't know if many of you remember that a semester is 14 weeks in college. If you have children in college, you might know that. But I make, instead of 14 meetings, I make 7 meetings that are 4 hours in length. Now that might sound like a long time to be together with a faculty member in a cohort. But since there's so much interactivity in the classes, there's been no complaints about the 4-hour meetings. And then you only have to come to campus 7 times. So that's 7 times between September and December. January is pretty much a break at Hofstra, and then February to May. And then if you go in the summer, that's another schedule. So the face-to-face course, as I said, an executive model, and it's been late afternoon, early evening from 4:30 to 8:30, and that's what it was this whole year. And the cohort picked the day of the week they wanted. So the current cohort is doing Wednesday. So the new cohort will get to choose that. And we try to keep the day of the week the same for the 2 years that the program runs, so people can adjust their schedules accordingly. So for most people, it would mean leaving the office by 4, and you'd hopefully be home by 9, depending on your distance of travel. The online class, obviously, you don't have to leave your location. You take that from wherever you want. It's a mixed course of synchronous and asynchronous. What do I mean by that for the new people to the online world? Asynchronous means that you're not online together. You're learning from online material, but you're not doing it as a group. When it's synchronous, you're learning from online material, but you're doing it together as a group at the same time. So currently the model we're using is a hybrid model, some asynchronous and some synchronous. And the synchronous time is 4:30 to 8:30 on the alternate week of the face-to-face class. So basically, I've asked people to block out weekly from 4:30 to 8:30 on a Wednesday for this year. As I said, it could be different next year. And be able to be available for the online course, some synchronous time, and then, of course, the face-to-face. The summer courses would be electives. This summer, I'm offering an elective on using medical humanities as a pedagogy to teach. So teaching through art, literature, poetry, cinema, documentaries, music. And those are ways that you're able to teach clinical, medical, health humanities information through these pedagogies. And it's really a fascinating way to teach. So I'm offering that elective. And next summer, I hope to offer an elective related to simulation teaching. So the next thing is a capstone course. Everybody will do a capstone project. It's 3 credits. And it will hopefully be something that is very professionally applicable to your area of expertise. And you'll have a mentor for your capstone. And hopefully the goal is something so scholarly that you'll be able to publish that in a journal that's appropriate to your professional area and get scholarship credit for your work. I'm hoping the electives also can inform your knowledge base for your capstone project. These are some quotes from participants that are currently in the program. I think most of you are able to read. There's quotes here that there's an RN quote, an MD quote, and you could get an idea of what the current cohort people think. These are directly from them. We've solicited these just to be able to give you a sense of how people feel. Mike Casera is a physician in Northwell Health who has a master's in health professions education. He did his degree at Penn because there was nothing locally. So he did an online mixture of online face-to-face at Penn, University of Pennsylvania, and he's teaching in my program. I have an adjunct who's teaching from Florida who's been very well received, and some other adjuncts. So there's a variety of faculty who are teaching in the program. So far there's 4 of us, and I'll be back for medical humanities. And then next year for some of the leadership courses, I have a new faculty member who's actually somebody who works at Northwell, but he teaches leadership courses. So he'll be teaching in the fall one of the leadership courses. So I have a variety of faculty. To apply, you have to do an online application. The website, it's very easy, hofstra.edu/gradapply. You could get that link off the program website, which if you just Google Hofstra HPPL, you don't even have to spell it out, Hofstra HPPL. I did it today. The program comes up, Health Professions, Pedagogy, and Leadership, and there's a link off that for you to apply. There's also a video if you want to listen to me anymore or see what I look like. If you haven't met me, you could watch the video. And one of the most important things there is a sample template of the program mapped over 2 years. That's just a sample template. It doesn't exactly get off it that way, but it shows how you could finish the program in 2 years without a problem. It would require one elective in the summer, each summer, but then you'd be done. The other thing that it does show you is the diversity of some of the electives that I've researched. You can really get any elective approved with my permission, but I've researched certain electives that I think are beneficial. And so the template of the plan of study is on the website. You do need a bachelor's degree to come in this, a strong preference for anybody, of course, with an advanced degree in health professions. The only transcript you need is your last transcript of your terminal degree, whatever that is. So if you're an MD, your MD transcript. If you're a nurse, your final nursing transcript. Whatever profession you are, you only need your terminal one. You don't need all of them. GPA of 3.0, and the written personal statement of professional intent is very important because that's going to tell me if this is the right program for you. I don't want anybody in this program that it's not the right program for what they want to do. So someone called me the other day as example. She happens to be a physician assistant, and she said, I don't know if this is the right program for me. I said, so this is my question. Where do you see yourself in 5 years? What do you want to be doing in 5 years? And I could help tell you if this is the right program for you. I certainly only want people in this program that it's the right program. So the personal statement of professional intent is really saying, where do you see yourself in 5 years? And then I'll be able to say, this is the right program. If someone tells me something that's not aligned with this program, I would suggest they go get a different degree. So it's really important, this personal statement, for me to understand who you are and where you want to go. I want to mention there are no GREs required for this program because to me, people are coming in who are academic professionals who I feel are strong enough that they don't need to go back and take a standardized test. We are having a face-to-face open house at Northwell Health next week on April 24th. If you would like to meet me, even if you heard tonight. And then we'll be having 2 open houses, one in July and another one in August at Hofstra. There is a tuition benefit package at Northwell or anywhere you work. There might be a tuition benefit package, and those details we probably should discuss offline, but it would be important to contact your human resource person and discuss the tuition benefits. That's my presentation formally. I would love to answer any questions that anybody has. So a question that we have is, how long does it take to complete the program? As I said, is if you did 2 courses in the fall, 2 courses in the spring, 1 course in the summer, then 2 in the fall, 2 in the spring, and 1 course in the summer, you'd be complete with the program. If you want to take 3 years, you can reduce the coursework to 1 each semester, and you could take 3 years to complete the program. That's not a problem for me. It's really your choice if you want to spend 2 or 3 years doing this program. There is a scholarship available for people who take 2 courses, 6 credits, and do it continuously for 6 semesters. So there's a financial benefit to doing that if that's something you're able to do with your schedules. So in terms of scholarships, there's a question. There is a scholarship of $1,000 a semester for 6 semesters if you take 6 credits a semester. In addition, you could look into, as I said, your human resources and tuition benefits. And then if you happen to be in a certain profession, sometimes the professional organizations offer small scholarships that you could look into.